Hello, I'm David Kimberlin. I am the program director for the IDC New York meeting, which will be in November of 2024. Many of you who are watching this have been with us in years past, and if you have been, we would welcome you back this coming November. If you've not been to an infectious disease in children's symposium, please come this year. I think you will have a wonderful time. Our program is phenomenal. The program committee has put together a tremendous assortment of topics. We will be talking about vaccine preventable diseases that we thought were gone and that are not, chickenpox, measles, others. We're going to be talking about as well new ideas that are coming along with respect to meningococcal vaccination recommendations. Meninge, as many of you know, is a very complex topic when it comes to how you prevent it, and it's getting even more so. But there are efforts underway to simplify that, and you will be brought up to speed on what the most recent cutting-edge developments in that regard are. We will have vaccine updates, and that will include new ways that you can communicate with your families, new AAP guidance on vaccine communication and how to increase vaccine uptake as a consequence. As you all know, we have a new Red Book, a 2024 Red Book that was released this year from the American Academy of Pediatrics. I'm the Red Book editor as well, and so I'll be giving an update of what's new in that particular publication and drawing your attention to some of the key things that I think are changes from the 2021 edition that are really exciting. We've had an STI talk as well added to the agenda this time. This is for adolescents with STIs, so something that we are increasingly seeing, and I'm sure that you are as well. We also are doing something really interesting this year. Many of you would realize that for those of us that are in research in infectious diseases, the NIH institute that we apply to is called NIAID. That's Tony Fauci's old institute. And it stands for the National Institute of Allergy and Infectious Diseases. So these have gone together, infectious diseases and allergies, for decades. We've not talked about them at their meetings. So we're going to expand to include allergy talk, specifically a food allergy talk, and then a talk on antibiotic allergies. And thinking about it, certainly there are true antibiotic allergies, but many people are labeled as being allergic to a particular antibiotic when they're really not. So we're going to be talking about how and have an expert presentation on how you can safely de-escalate, de-label someone who is currently carrying that kind of a diagnosis. And then, of course, we have all of our core lectures that are tried and true and audience favorites. We'll be doing those, and we have many other things as well. So I encourage you to look at the program. Please consider coming. We would love to see you there.